Good afternoon. Nice meeting you all. I'm Dr. Marian Hendy, a pediatric specialist in Medcare Medical Centers and hospitals. So I'm talking about advancements in pediatric care today, not specifically cardio in general. So in pediatric healthcare field, the changes are happening rapidly. And nowadays, we can see that there are continuously new researches and new technologies, and the advances are so fast and updated every day. It's very important for us as healthcare professionals and for parents as well. And for parents as well, we have to conduct to them the updates. Okay, so it's very important as healthcare professionals, especially pediatricians, to be updated by the new updates in the field, and to update the parents also about the new updates and new technologies. So the advances in pediatric care ranges from the newest treatments for childhood illnesses to innovative technologies for early diagnosis as well. These advances are in different sectors of the children's health care, including genetics, immunotherapy, mental health, and much more. And this helps actually massive improvement in the early diagnosis and the integrated management of some conditions that before were considered fatal or very difficult to be managed. We will explore here some of the most recent advances in the pediatric healthcare and their effects on patients and their families as well. So medical and technological advances have resulted in higher survival rates in some children and adolescents that were not able to live with a high quality of life before, and some of them also were having some conditions that were considered fatal, but nowadays they are manageable and actually they can live a good quality of life. So as I highlighted here, our aim and our job as pediatricians is to add life to the child's years, not only years to his life. So let's go through some of the advances. So one of them is in genomics and precision medicine. Another sector is in immunotherapy. And actually, immunotherapy is helpful in allergy and also in oncology. And telemedicine, and we are all aware about it after COVID, and it was becoming very popular since then. And the artificial intelligence, also we'll talk in short about mental health. These advances actually provide exciting opportunities for medical professionals and for parents as well, taking us ever close to them, and we'll go through one by one in short. So let's start with the genomics and the precision medicine. There is something called the Human Genome Project, and this is one of the greatest advancements in history in general, not only in pediatric care. This project started actually since October 1990, and was completed in April 2003. It's a huge and very helpful project that came out with the full human genome. So we could understand the fundamentals about the human genetics. And since then, it's accelerated to understand more and more of the human biology and improve in the practice of medicine. So knowledge in general that we got from this extraordinary research effort is used now to advance our understanding for biology and for the diseases and how to diagnose them early, and also about the management. So the National Academy of Sciences has called for the adoption of something called precision medicine. This means it's like specialized treatment for everyone depending on his or her genetic understanding and genome. So this guides the individual diagnosis and the individual treatment as well. Precision medicine is the focus on identifying optimal care based on a unique personal profile, individual differences in genetics and exposures and in lifestyles. So precision medicine program aim to utilize the new technologies to identify personalized treatment for children with genetic diseases and with cancer. So delivering this program is very helpful, but actually it requires a multidisciplinary team. It's not a one-person effort. It requires a team consists of oncologists, surgeons, clinical research associates, scientists, genetic professional, pathologists, technicians, and nurses. Although some people got some emotional upsets about this because they will understand and predict that the child will get some of the genetic diseases or some cancer, but still it's very helpful in prediction of the disease before happening. Prevention can be done sometimes. Early diagnosis will definitely help in the early treatment and the cure of the disease. So second one is about immunotherapy. And as I mentioned before, immunotherapy is in many categories, but we will go through the allergen one and the oncology one. So there is something called allergen immunotherapy or allergy shot, as it's known by most of the patients and their families. It involves injection of several allergens to the child after confirming the child is having some kind of allergies by the skin prick test or by blood works. So after we confirm the child has specific allergies, we start injecting the child with these allergens in small amounts, increasing gradually till he's completely exposed to the highest doses. So this actually control the immune response to this allergen. So it's not indicated for everyone actually. It's indicated in some conditions like when it's moderate to severe allergic reaction, not in mild cases. Also when the symptoms have not responded well to medical plans. So other plans are already tried and no response. Or when the medications are not desired. Some children refuse 100% to receive any oral or injectable medications. Then when the side effects of the medications cannot be tolerated by the child, or the environmental changes and control of the allergens are not possible. This gives a great improvement of the children after doing this procedure. But how is it done? First injection consists of a small amount of the least concentrated extract of the allergen. Then each week the dose is gradually increased and till we reach the maintenance dose, and usually the maintenance dose is reached about 24 weeks after the beginning. And once the child is receiving the maintenance dose, the allergy visits are spaced, not every week like before. Then it can be gapped for 2 weeks, then 3 weeks, then 4 weeks gradually. And it's recommended for the children with severe allergies to receive these shots, the maintenance doses for 3 to 5 years, and in insect bites or severe allergies, it should be given for longer. But usually after they stop it, allergy doesn't come back. And it's proven already with some patients. But all the injections should be monitored by a physician. The nurse cannot give it alone. A physician should observe the child for 30 minutes after the injection, especially on the day of increasing the dose, to observe for any adverse reactions. And the child should be forbidden from any vigorous activity for the next 2 hours. And then immunotherapy in the pediatric oncology. Also, there is some advancement, but still it's under studies and trials, but it gives hope actually to many children with cancer. So immunotherapy is being popularized as an approach to target pediatric cancer. This treatment modality has proven effective in pediatric hematological malignancies, such as acute lymphocytic leukemia, but remains still difficult to manage the solid tumors, but there are some emerging studies working on that. Hopefully it will come out. So two broad immunotherapy approaches may be utilized actually for this treatment of the solid tumors. They're working on them. One of them is direct utilization of the immune system properties, and the other one is immune system modulation. Within each of these categories, many challenges are there, but as I said, they are working on it. And the advent of immunotherapy to manage and treat malignancy is improving day by day. While the majority of the related studies performed till now have focused more on the adult malignancies, but some of them give hope to the children as well. So the approved immunotherapies for now, over the past few years, is proved and approved also already by FDA. Some of the monoclonal antibodies and some of the CD19 and GD2 also antibodies. Some of them are started currently to be worked on, and some trials are going already on them. And they are actually changing the treatment landscape of pediatric cancer, and the success in this is largely based on the choice of the target. They work on, they can't use one of them without any proven data and studies. So they work on the choice of the target, and they are trying with different kinds of antigens to find out the effective antibody. So metastatic and recurrent solid tumors are the hardest to work on, once the survival rate actually till now is only 20%. So still this is emerging, and they're working on it, and the trials are going on. Next is the telemedicine, and as I mentioned before, it was something weird, but nowadays after the pandemic, it's very common and everyone is using it, but it's not actually applicable for all the illnesses. In pediatric diseases, we can do the online or teleconsultation for some mild symptoms or mild complaints like cold symptoms, allergies, conjunctivitis, rashes, skin infection, insect bites, minor injuries such as bruises, animal bites, behavioral or emotional concerns. But for others, we cannot do this if it's required physical examination, checking the vital signs, or doing more investigations. We'll go through the artificial intelligence as well. It's also an emerging field. Actually, the AI is now included in everything, all industries and all fields, not only the medical, but hopefully it will also improve more and more, and it will help like in electronic updates about the patient details. It also helps in the imaging. When we do an X-ray, it comes automatically, the report or the outcome of the result. So it helps, but till now still also it's emerging, it's under trials and studies. As with many other fields, the AI will change the healthcare landscape also over the coming years. In addition to improving the health facility operation, patient diagnosis, treatment plan, development, and overall health outcomes, the AI is also expected to help with the development and discovery of new medical cures. So the use of it in healthcare is expected to grow significantly over the next decade. According to the Grand View research, AI in healthcare is forecasted to be valued at $208.2 billion in 2030, which is many times higher than its in 2022 market size, that is just $15.4 billion. So it's emerging, but it's really going so fast and very promising. Also, mental health has improved recently, and many advancements happened there. So currently, we can find out that many of the ADHD or autistic children are well. Some of them you cannot even recognize that they have some disability or some problem because of the multidisciplinary improvement, included in the treatment of the child. Before, it was very difficult to find someone to help these kinds of kids. But nowadays, some of them also are enrolled in normal schools, and they can deal normally with other kids without being bullied or having negative outcomes. But as I mentioned, they need also multidisciplinary team. So not only the pediatric psychiatrists, they need behavioral therapists, cognitive treatment specialists, and many others to help this child to look similar to normal with minimal negative outcomes. So there are many other aspects actually of these advancements in the pediatric healthcare, like in acute nutrition, malnutrition, safety in children with disabilities, in enteral nutrition instead of TPN in the premature infant, in palliative care, in post-cardiac arrest care in children and youth with special healthcare needs, and in minimally invasive pediatric surgeries. So we'll go through the last two only, children and youth with special healthcare needs, that's called CYSHCN. This actually helps these children to have not only life, but also well-being, school engagement. They help the parents also to accept and tolerate the burden on them, because it's really burden to many parents that sometimes they give up and don't continue in this program, but they help them to continue, and they help the poverty and the social problems. So this team helps actually the children and youth with special healthcare needs to live a good quality life. In minimally invasive pediatric surgery also, now it's emerging also and very promising, because many laparoscopy, laparotomy, small incisions, robotic surgeries, and some of these are under trials, and they are very promising as well. Not like before, it was a major surgery for pediatrics. So in conclusion, medical and technological advances have increased survival rates and enhanced the quality of life for infants, children, and youth with chronic life-threatening condition. Advanced care planning includes a process of discussing life, sustaining treatment, and establishing long-term care goals. Pediatric healthcare practitioners have an ethical obligation to educate themselves. We should be aware actually about this day by day, about this aspect of medical care. The present statement aims to assist healthcare practitioners to discuss advanced care planning for pediatric patients in varied settings. Advanced care planning requires effective communication to clarify the goal of care and establish agreement on what treatments may or may not be appropriate to achieve these goals, including resuscitative and palliative measures. Thank you.